It was a very heavy journey.
53-year-old Mercy Washuka knows all too well about an ailing kidney and even its failure.
The problem was that I had an infection, so it grew and it became a kidney issue. I actually just used to feel sickly.
Her symptoms that began in 2018 would see her take several trips to the hospital and undertake 3 sessions of dialysis every week.
Every time you do dialysis, it is too heavy on the body. So, like for me, food was ugali and strungi. A small piece of ugali and strungi. I think that was maybe to just keep myself alive. But feeding was an issue. It was a bad process. It even took me back to diaper.
The excruciating experience she had prompted her to give much thought to kidney transplant. Her thoughts would be actualized 4 months ago.
October 15th, that's the time it was done. So I'm around between 4 months and 5 months old. And I appreciate to God that I'm alive. Yeah, but the kidney is good and it's working well.
The Ministry of Health has cited that in the last 1 year, there has been an increase in chronic kidney disease in the country.
Imagine moving from 300 patients to 6,000 on dialysis.
In the year 2020 to 2021, our total payout for health coverage was 54 billion. Of that, the total payout for renal and for dialysis payout was 3.84 billion, totaling to 7.1% of the total of the expense benefit, being the 4th most expensive benefit for the fund.
Dr. Srinivas Murthy, a nephrologist at Medihill Hospital, advises Kenyans to make a habit to take tests on their kidneys.
These medical and metabolic diseases are silent. They won't announce themselves till it has damaged the kidney completely. Now you become sick because of the failing kidney, it's already late. By the time you see people like me, I'm not at the stage of prevention. I'm at the stage of first treatment or replacement. Actually, 90% of my job is replacement.
While marking the World Kidney Day at the Kenyatta National Hospital, health sector stakeholders now hope for a change in the law to allow increased availability of donor kidneys.
You can choose to give your kidneys when you die and other organs, or we can take it from you if you deem say you don't want to give. Obviously, we must start from the easier position, and the disease donor program will have very many ways we shall have to look at. How do we make sure that it is ethical, that grafts will not only be given to those who are rich and such other privileged people, and that it is used for everybody.
Patients have also called for inclusion of more services by the National Hospital Insurance Fund, particularly post and pre-transplant care.
We are really working towards focusing on working towards transplants so that we can reduce the number of patients on dialysis. And the second thing that we've done after this is that now we are looking at the benefits packages and what Gikonyo was requesting on ensuring that there is post-transplant management, because we're already paying for transplant. We're also going to include it in that package.
Ben Kirera, K24, Nairobi.